What off-label uses does sucralfate have beyond ulcers? Imagine a medication that does more than just treat stomach ulcers. Sucralfate, originally approved for duodenal ulcers, has several other uses that can help with different gastrointestinal issues. Even though these are off-label uses, meaning they are not officially approved by health authorities, many doctors have found them helpful based on clinical experience and research. One common off-label use is for managing gastroesophageal reflux disease and erosive esophagitis. While sucralfate is not a primary treatment for acid reflux, it can form a protective barrier on the esophageal lining. This barrier helps shield the tissue from acid, bile acids, and digestive enzymes that can cause irritation. Some formulations, like pre-polymerized sucralfate, create a stronger, more adherent coating, which can improve symptoms and help heal damaged tissue in the esophagus. Another off-label use is for preventing and treating stress ulcers. These ulcers can develop in critically ill patients or those undergoing surgery due to severe physical stress. Sucralfate's protective properties help prevent these ulcers by coating the stomach lining and reducing the risk of damage from stomach acid and irritants. Sucralfate is also used to treat dyspepsia, which is a fancy word for indigestion, and to protect the stomach from damage caused by non-steroidal anti-inflammatory drugs. Patients who need to take NSAIDs for pain or inflammation but are at risk of stomach lining injury can benefit from sucralfate to reduce irritation and erosions. In addition, sucralfate is sometimes used to manage mucositis, which is inflammation and ulceration of the mucous membranes caused by chemotherapy or radiation therapy. It coats the mucosa, helping to reduce pain and promote healing in the mouth, throat, and other parts of the gastrointestinal tract. There are also reports of sucralfate being used to treat other epithelial wounds in the gastrointestinal tract, like in the mouth or throat, and to protect mucosal surfaces in various inflammatory conditions. In the context of acid reflux and GERD, sucralfate's main role off-label is not to lower acid but to form a physical barrier. Unlike proton pump inhibitors or H2 blockers that reduce acid production, sucralfate sticks to the damaged tissue and shields it from further harm. This makes it a helpful addition or alternative when acid suppression alone isn't enough or isn't suitable. To sum up, beyond treating ulcers, sucralfate is used off-label to protect and heal the lining of the esophagus, prevent stress ulcers, guard against NSAID-induced damage, and treat mucositis. Its ability to form a protective barrier on irritated or wounded tissue makes it a versatile option in many gastrointestinal conditions. Newer formulations like pre-polymerized sucralfate have made it even more effective in these roles.